Hello, this is Hope Whitaker from IT. I'm doing a quick, hopefully fairly quick demo on the new Clinician Hub ClinDoc documentation features that will be coming to a DCHS computer near you the end of the month. We will be upgrading from FizDoc to ClinDoc. We have to do this for regulatory requirements, and also it is getting rid of Internet Explorer and using Chrome and Edge, much more reliable coding. So hopefully we won't see all the issues we've been seeing in the past with Internet Explorer. As you see, the window is the same. It looks very similar. I'm using a test physician, and so I have turned off my single sign-on, but for you, once you log in to this new application, it will put in your username and password for you as it has in the past. This is an upgrade environment. It is slower. We don't have a very beefy upgrade test environment, so you might see a little bit of delay here and there, but this should be much better when we have our production environment and have more than one server that we're working with. As you can see, the main census window looks exactly the same as it has in the past. It's got my name up here. I'm WXX physician, and I've got my census here with all my patients that I can look at. For any testing that you're doing going forward, if you use the season patients with the last name of season, you'll see more results on those patients and documents, as we've been using those patients for testing the upgrade environment. I'm going to select my patient Spooky. As you can see, everything looks the same. We've got the place card up here. We've got the information down here to the left that shows you can drill into the patient profile for any information that you need. The thing that's different in this upgrade is the documentation. It went from FizDoc to ClinDoc. Once I click on my documentation window, as you can see, it looks a lot different. I can minimize my workspace window here so I have more real estate. You'll see in the middle, this window is basically where you're going to be doing your documentation. And the third window to the right here is your preview window. See the preview window here? Basically, the preview window is going to show you everything you're documenting on the note in real time. You have that it's unsigned at the top. You have your patient information, MRN, admit date, visit ID, location, the attending, and then, of course, at the bottom of the header is the name of the note. This note that we're looking at was previously documented on the 28th, yesterday, the history and physical note. And as you can see, it is unsigned, but everything is there. So it could be edited if we wanted to. On the very bottom of the window, you will see it was created by XX Physician. It was also edited today, but it is not signed yet, so we can continue to edit it until it's signed, and then an addendum will have to be done. You can see that you can print it. If you want to click, you can actually print it. It opens up another window and gives you a print preview. Here's your print preview window, and it will show you the document. We can make it bigger if we want to. It'll show you the document in the window, and then we could actually go ahead and print it if we wanted to. That's a little bit different functionality than we had before as well. We tried to recreate the notes as closely to the FizDoc look and feel as we could, but this is a different application, and some of the functionality has changed, so we did the best that we could. If you look at the top, right now we're seeing all notes for this visit only, and all note types. I can change that from the visit and go back to all visits, and it'll show me all the documents from all visits, which was the default, I believe, in the FizDoc documents window. We have some from way back in December, all the way to the note that was created and edited yesterday, the H&P on the 28th for this visit. And we can actually see the document that we have highlighted, we can actually see that document in the preview window on the right. Right now we are going to create a note. I'm going to do another H&P note. There is one on here, but we're going to do another one for the purposes of this demonstration. Okay, I'm going to add the note. As you can see now, we have a big working area here. This is going to be your working area of your note. And then on this side, we can select what note we want to document on. I have pinned a few up here. How we do that is you can have 5 titles that are pinned at the top here. I'm going to unpin this from the top of the list. And now when I go to search or refresh, it should be gone. I have history and physical pinned. What pinning does is just put it at the very top of your window so it's easy for you to see it and to use it. Right now we have history and physical note DCHS pinned, progress note, and sepsis note. If I say, gee, you know, I think I want to grab a procedure note. Okay, see the procedure report down here, DCHS. If I hover or click on that little trio of dots, I can actually pin it to the top of my list. So now I have it pinned. I can pin up to 5 notes here. It's very easy to do a search. We don't have that many notes. And here's the 3 notes. We have new discharge summary, newborn discharge summary, newborn history and physical, and a newborn progress note. And if you get rid of the search, it'll go back to our basic 20 notes that we have down here. We don't have that many to search through that we're using. I'm going to do a history and physical for the purposes of this demo. If you look here, you don't want to just type in the general notes. This will not give the note a name. There's not going to be a note selected. If you do not select a note type, it is not going to go over to one content, and it's not going to show what type of note it is. How I do that, before you selected it from a list and it opened, when you clicked on the paper, we are going to highlight the history and physical note. See how I still have the left click on there? I'm going to drag it and drop it into the blue area. See how I did that? Let's cancel that note. I'm going to go back to my notes, add a note down here, add a note. There's my note types. Click on history and physical, hold that left click key down and drag it over until you see the blue. Now, as you can see up at the top here, we have a note type. This is a history and physical note type. It does look different, which is why you want to make sure that you have this preview pane open on the right-hand side. See how we have the preview pane open? This is showing you exactly what that note is going to look like on the back end of the report that's being sent to One Content or any printouts. As you can see, there is some information that's being auto-pulled in. The labs are being auto-pulled in if they've been done in the last 24 hours. And if radiology has been done in the last 24 hours, we do have the most recent vital signs. We have the Tmax of 100.0 degrees Fahrenheit for the last 24 hours. All of this information is being pulled from the chart that the nurse has already documented on. As you can see, we've got a lot of headers here. We tried to limit the headers and groupings as much as we could. This is a different animal than PhysDoc to configure, and this is kind of the best that we could do. If you look, you can open the plus sign and you can collapse that section or that header. Otherwise, up here, you can expand all of the headers if you want. If you want to do that, you can expand them all and just scroll, or you can collapse them all. Keeping them collapsed, you don't have to worry about keeping an eye on what you've documented because it's all over here in the preview section. This is what's going to be in the output of the note. So let me go to the very top. I'm going to click on telemedicine here. This is a telemedicine encounter. Yes. If I select yes, see how it comes over here. And again, we had no control over the output of the notes. This is what it looks like. You can put in your primary physician. Oh. Your attending physician. If you have a consulting physician, you can add that in there. HPI. If you look, the little plus sign expands the section, so we can say if the HPI is reviewed or updated. You don't necessarily have to do this on the history and physical note, but it will be available on the progress notes as well. So I'm going to put a complaint in. Okay. History limited to, we've got some selections here for you to click on. If I were to click on intoxication, as you can see over here, see my HPI, history, complaint, chest pain for past 9 days, history limited to intoxication. If I want to do something here with the history of present illness, and I have my dragon, I can do my dragon shortcut, or there's a new feature where you can do your own macros now. See the little 3 lines at the very top to the left of your name on the very top blue ticker screen? They call it a hamburger for all scripts. I just call it 3 lines. But the little hamburger with the 3 lines, if I click on that, I can manage my macros. Now I'm going to have macros that are already in here that I've created. I can import shared macros. So if you know there's macros that have been completed already that haven't been shared, you can click on it. It'll give you every macros that's in the system, and you can import it, and you can even change the name of it for yourself if you want to. I'm going to type in, if you look, I can search for HPI. And I've got HPI period. And as you can see, if you create your macros, I'll do a little demo on that later individually, but they actually have data where it'll pull in the patient's age, male or female, and their chief complaint from the chart. There are a few other patient and demographic things like first name, last name that we can pull in as well. So let's close this. I'm going to click in the HPI here, and I'm going to do HPI period with a space sign. And as you can see, I did the name of the macros, which was capital H, capital P, capital I period, and it came in. If I say, wait a minute, that's not my macros that I wanted. See how it populated the HPI period? Space bar. 41-year-old female admitted with hospitalist testing patient. That's the name of the chief complaint I have on this patient. And then we can keep typing complaints of chest pain for past 4 days. See how that actually expands, the window expands. They keep the windows very small with the text narratives so that it takes up less real estate on the page. If that was not the macros that I wanted, there's another macros in here I can use. It is, I believe, js.ros space. That's review systems. Sorry about that. There's my macros. Complaints of chest pain times 4 days. And again, we have tested We have tested Dragon on this. It will work. You click in those larger boxes and it's going to work just fine for you. Another thing you can do once you are typing in here, these narrative boxes have a limitation of 4,000 characters. We can't increase it. That's the way they have it coded. But you can always click on this plus sign on any of the headers or sections, and you can add another narrative. This gives you 4,000 characters here, and then you have 4,000 characters up here as well. So if I'm typing in here, here is an additional box for more narrative information. And if you look here, it'll show you and it goes at the top. So if you know that you're going to have more than 4,000 characters, you can actually start with the plus sign, put your characters in there, and then you can actually add more at the bottom. There's 4,000 characters there as well. 8,000 characters is quite a bit. I did a lot of testing with your previous notes and copying and pasting, and it seemed to work fairly well. We can collapse all again. See how you've got a running note here in your preview. I'm going to go to review of systems. We kept in the review of systems. That is the clicking review of systems. If you decide that you want to do that, you can click negative for the entire constitution and it'll show you negative except. Negative, but negative except sweats and fevers, which is pretty quick actually if you like doing it that way. Eyes are negative except they're having some blurred vision. So you can take a look at these, and you can always do an extra narrative box whenever you see a plus sign there. The other thing that you can do at the very top, if you just want to do your review of systems in a narrative because you used Reagan, click on the plus sign, and now we can actually put in our macros, or we can click and put in our Dragon shortcut. So I am going to say my macros, and this was in the other system for, it was in the other system for PhysDoc. I put in the name, hit space, and then we're going to do dated today. There's my review of systems. Alrighty, I can collapse that, and there is another review of systems note down here that gives you a lot more space if you're running out of your 4,000 character limit. There was no way to increase that. That's the best that we could do with the functionality that we received with this application. Medical history is here. You can add your medical history. If you have a shortcut, surgical history is here. Problems, nothing was entered as far as problems in patient profile or in the chart yet, so nothing's coming over. Nothing's been entered for surgery and procedures. See how it doesn't show the full problems and surgeries and procedures because nothing has been documented, but it's showing you that nothing has been documented. For allergies, allergies were already over here, so this was documented by the nurse on the floor and patient profile when the patient was admitted. Home medications were already over here, but you can open that, and if you want to add a note or a narrative to those home medications, you certainly can do that here. And if for some reason you want to hide these components and get rid of them, say you're never worried about the sepsis focused exam in this note, because you always do a separate sepsis focused exam, you can basically hide this, and it won't show up. The component's not going to show up at all for you on the note. All right, anything that's been documented, immunizations are here. See how the social history has already been documented. Nothing was entered, never smoked. That is all over here because it has been addressed on the no knowledge of family history. Hasn't really, so it shows you it's been addressed, but nothing is showing up. You have your MOS here, and that has, so if they have snoring and a BMI greater than 40, you can click on that box and see how it shows you a running calculation. MOS health risk, if total points for this section is greater than 2, enter 2 here for the MOS. So we can do that. We're going to enter 2. There's my respiratory rate. We're going to add 2 here. And it actually shows you here for the MOS. There's the Pacero opioid-induced sedation scale. I can't talk today. And then here's the MOS interpretation. This is really nice. So if we see that the patient was a 4, put the total score of 4 here. And it actually tells you what to do with your MOS score. So this is kind of a cool new feature that was added with this application version. If you want to put additional vital signs here, you can. This is the same as the additional vital sign text field that you had. We could not put them together. They have to be in separate headers because of the way that the application is configured. Pain, you can do a pain scale score here. Physical exam, again, this is the canned physical exam. So if you click on this one, it shows you constitutional within normal limits. If it was not normal, you're going to see things pop up, trailing things that you can actually document on. And you can always do more just on the constitutional here. So if I just wanted to document just on the constitutional part of my PE, I could do it here. I can click on within normal limits. Let me unclick this. It's taking a few. And it'll actually do within normal limits for everything, with the exception of the constitutional being. See how it's abnormal here? Because I put no. If I put yes, then it shows all of the defaults for the normals. And again, if you don't want to do it this way, you can always add a narrative and just put in your physical exam, either from your shortcut or if you have a macros. Typing in my macros and I'm hitting the space bar. There we go. And then I can make changes. You can make any changes here that you want. Alrighty. And this is what it looks like over here as far as physical exam. Once I've clicked out of there, you can actually see it over here on this side. It's all the pulses. It put all of my within normal limits in there. I'm going to collapse these, and I see that I'm down below the physical exam here on this side of my note. Let's go to results. Okay. For results, you can copy and paste any microbiology, radiology, cardiology, pathology, and you can do anything with lab results text that you want to here. This is the auto header. If it says last 24 hours, let's do 36. This is a cool new feature. So if it's been more than 24, you can do 36, you can do 48, or entire visit. So by looking here, everything gets auto-populated on this side to be able to do that. Another thing that you can do as well, okay, see how we don't have anything auto-populated for microbiology, radiology, the other results besides the labs. We had the clipboard before. If you look over to the right-hand side of your screen, you're going to see results and you're going to see orders. This is kind of the old clipboard. It'll pull any results that are in the patient's chart for you to be able to grab. So there is some diagnostic imaging here. So I can actually click on the results of the CT of the head. And as you can see, we're testing. So these are not very clinical finding results, but we can copy and paste this. You can't do a right click anymore. You have to highlight it, do a Control C for copy, or I can just click include a note and cancel. I want to put it where I want to put it, so I'm going to put it here under radiology, and I'm going to do a Control B. Oops. Let me do that again. Let's do include a note here. Okay. Okay. Control C. I'm going to add it below the results. And there it is. It's going to add it above my results in the note. See, I want to put the PA and lateral in there as well. I'll click on that result. It's taking a few minutes. Sorry about that. Okay, X-ray chest, PA and lateral. Again, we're just testing. So I'm going to basically highlight it. And when I do include a note, it's going to include it at the same place. So if you look now at your preview, you're going to see when you go down to the results, the diagnostic imaging results were also included above the laboratory results. So it works really nice. I think once we get live with this, you're really not going to need those boxes anymore for the microbiology and things, because it'll actually be included in the note, you know, at the same area results. We can actually do, if you want to do more than a month, you can do the last 6 months, and it'll actually give you labs from previous visits, which is really nice. So see, this hemoglobin was from the 1st of December down here. And we can highlight that. See how I highlighted that? And I highlighted the basic metabolic profile, and I can click here. When you hover, I hovered over include a note, and I'm going to add it below my diagnostic imaging results. Or I can put it at the bottom if I want to. And now you're going to see it right here. And it shows you that hemoglobin was collected on the 1st of December. So that's kind of a nice feature. It's kind of the clipboard on steroids that we used to have. Now that you can see, we're going to go back to preview. Preview over here. See the preview of my note? I've got all my labs in there. I'm going to collapse these because I know I did all my labs. That's where I'm at next. So now I'm going to look at, I don't need anything for ventilation. Relevant findings from previous records. If, you know, we may not really even need to use this anymore, since we can actually put in the relevant finding from previous records in that same area with the results. Assessment and plan of treatment. Okay, we've got assessment and plan of treatment. If anything is entered in the profile, it'll actually come over. This is an auto pull. But here is your typical assessment and plan here. And that is going to give you the ability to put in 4,000 characters. And if you think you need more than 4,000, start with the top box, tape it in here, and then you can actually go to the bottom box and put more text in. Orders, again, these boxes give you 4,000 characters. Orders, we can actually put some orders in. There aren't any orders there, but if you come over here by the results, we have orders over here. And again, medication orders, there are no other orders that I see. But this is one day, so I'm going to look back for this encounter. Now, if I look for the entire encounter here, if I select all, it's going to give me every single order this patient has ever had in the system. On those patients that you have in ICU, Dr. Fryer and Dr. Alstrom, and Dr. B, it may take you forever. You'll have to be real careful with these filters because it may take forever for it to open. But say I want to include this order. I don't want to include them all, so I'm going to unclick it. But I want to include this order for the oxygen at 2 liters. I'm going to highlight it, and when I hover, I can include it in note. Where is it adding it here? Automatically puts it under the bottom therapy orders right here. So it's actually really thick, really slick functionality. Excuse me. Now we have the same thing. This is the same housekeeping that we had in the other notes. If you want to put any information in there, estimated length of stay, how many midnights. You used to put that in by days. Here's the core measures. If they do apply, don't apply, and if they do apply, here's your information for the core measures, that the same thing that you've seen in your previous notes. VTE risk is low, so if I put low in here and I click on my preview, I'm going to change this to preview, I can actually see that I've documented as low. Patient interaction time is here, and if you can put in how many minutes, and how many minutes were spent on counseling, the topic, the time, and comments here for the patient interaction times. Attending physician attestation is here, so I can put any comments in. I can say I have reviewed the mid-level documentation, or I basically spent the entire time with the patient. Some of these, when you click on the editable or the highlighted text, it shows all procedures were done by me with a little checkbox, or procedures were performed by the mid-level provider under my supervision. I did all of the procedures, so I selected that, and it goes over here to show me what I've put in for the attending physician attestation under preview. Okay, I'm going to look at this. If I want to see it larger, remember, I can actually make this preview window bigger like this. See that little double-sided arrow? And I can actually see it a lot larger over here to look at it and see if there's anything that I want to change or need to change on my documentation pane on this side. Looks to me like I've done everything. So I am going to, you can save it if you want to save it and come back to it. So let's see, I get called away. So I'm going to click to save it. Okay, and see how it shows it's an unsigned note. I saved it, I did not sign it. So if we look back over here, see how I have all my notes here? Here is my note from today. My history and physical from March of 2022 today, March 1st. It's unsigned. It shows the attending, and if I look at the very bottom of the note, it shows me that it was created by me, test physician. Now, if I want to go in and edit it, I can click on the edit button, and I'm going to say, you know what, I didn't put my critical care time in. and I can make comments here. Again, click on it, use your dragon mic, and now I can sign it. I can sign and request a cosign if I'm a mid-level, or I can sign it. I'm going to sign it. If it says sign and request a cosign, it'll come up with the co-signature options for you. Similar. And see, now that I've signed it, it is a signed note. It is signed. If for some reason we have to go back in and do an addendum, the addendums are right here. So I'm going to add an addendum to this note because, oops, it's already signed and there was something I forgot to do. It's actually a really nice little box here, and you can put your addendum in. You can put your addendum in very easily. I can copy and paste it. Control C, Control V. I can paste it in here. And I can bold anything I want to if I need to do a header. I can bold it, I can underline it. It's really kind of a nice little thing. I can sign and request a cosign if I'm a mid-level, or I can just simply sign it. I'm going to sign and request a cosign, and these are my the last cosigner and the PCP. I'm going to have the last cosigner do it for me, or I could say, you know what, I think this is Dr. Fryer's patient, so it's going to search Dr. Fryer for me. Again, this is test, it's very slow. Putting in last name, first name helped a lot. So here we have Dr. Fryer, and if I click OK, that's going to go into his queue for co-signature, and see up here it shows me co-signature requested. And if I look in that preview at the very bottom, it shows all of the information that's been done on here. We can add as many addendums as we need to add, but by putting the addendums on here, the addendums go on and they are fixed to the bottom of the note, which is where they really should be for legal reasons. So this is the addendum functionality that we are using with this application, because the addendums are actually showing that there's an addendum on this note, which is really what you need for billing and for medical records legal purposes. So this is how we'll be using the addendum functionality. I can do a second addendum, and I can sign that one myself if I'm a doctor. And if you see, look in here now, I can see all of the information that's been put in this note. So that way, if I wanted to add an addendum, I could. Okay. So I could say error in initial documentation. You know, whatever you use on your addendums. I'm not feeling very creative today. It must not be Friday. Error in initial documentation. Gate is I can't type today either, apparently. Okay, now I see why you all use Dragon, because I'm not maybe speaking with typing either, slightly. Okay, it does show you if something is incorrectly typed. And look down here, see how we have 4,000 characters in every single note documentation area, the narrative text area. It shows you here how many characters are left. With our upgrade to PR13, we'll actually be able to see when we have how many characters we have left. That way, if you have something long that you're copying and pasting, you can look, paste half of it, sign it. I pasted half of my addendum here. Okay, I can sign it and see how it's going to go right to the bottom below the other addendum. You can do as many addendums as you want. And if you click the addendum again, you can continue on with your copying and pasting as well if you need to, if you need more than 4,000 characters. So there's a lot of way to get around the character limits. That's it basically for new notes. I'm going to show you if you want to edit a note. Okay, say I am another provider. I came in, now I'm taking care of Season Spooky, and I'm going to go to their documentation, and I can see exactly what has been documented by my previous predecessors. For the progress notes, the information will flow forward like it normally does, but the progress notes are the ones that you're going to have a lot more issues with copying and pasting over a progress note. Let me see if we have a progress note on this patient. A procedure report. Do we have a progress note? I don't think so. So let's select a different patient. Okay, I'm going to go down and find season. Actually, Uper Crazy Grandma. I think Uper Crazy Grandma has some progress notes. She does. Okay, so if you look, here's some progress notes that I actually copied and pasted from one of Dr. Fryer's patients to see what my limitation was. If I had a note that wasn't signed, here's an unsigned note. Okay, see how it's unsigned? And I can actually, if I want to, I can click by the, there it is, unsigned. I can click and only look at the unsigned notes. That way I can look over my queue to see if any have to be signed without having to look at my work queue. I'm going to look at the sepsis note. I'm going to edit it. I saved it. It's not signed. I'm going to come back in and edit it. Here's my progress note. This looks a little different. Remember the red comments that we had in the previous PhysDoc application? We lost that functionality. So Lisa and I had to get creative. See how it says info only? That is the red text that was the info only at the top of your PhysDoc notes. Don't click in here. As long as you don't click on that at all, it's not going to show up in your note. If it says info only, don't click, don't add anything there. I'm going to scroll down here, and it shows the vital signs and measurements that are pulled in. And we've got the assessment and plan. Now say on this progress note, I really wanted to add some more results on this progress note. Remember, this is my clipboard. I can go over and I can look at the results and I can add it from here. As you can see, there aren't any results on this patient, but I would be able to add them in from here if I wanted to, and it would ask me if I want to add them to the top, the bottom, and anything else as well. When I'm looking at this progress note, if it's my first progress note I'm doing on this visit, and this is a patient that you've seen on medical or an ICU or OB before, you can actually see these are the old progress, the prior notes. They are here. So we could actually open up this progress note. Okay, and we can look at what was documented on this patient previously, and I can actually copy and paste this and change it. There's her past medical history. This must be one of Dr. Fryer's very detailed notes. All right, so here's, I'm not going to put that on there, but I want her prior history on here. All right. Okay. Family history. I don't want any of that. Past medical. Okay. I can do a copy, and I can come over here, and I can either put it in my assessment and plan, or I can even put this in my general notes. You're going to see, though, that the general notes are at the very top. But see, since we have a note here, this is a progress note type. The current note is a progress note. And we can use that general notes functionality as well, as long as you have the note selected. You've got your note type, and you can actually put anything that you want as far as text in the general notes. This does not have a 4,000 or 8,000 character limit. There's very little limit with the general notes on the top here. So that's kind of what the general notes are there for. Assessment and plan, we can put the assessment and plan in there. So if we have an assessment plan from an old note, let's see. This is an old note from a previous admission. She was gone less than 72 hours and is a bounce back. We can actually do that from the previous notes. When we go live with ClinDoc, you'll be talked to by Lisa and I, and also by medical records. There's going to be a period of time when you have to stop signing in PhysDoc in the current application, and then those will be signed, and they'll be basically here for you to see under prior notes. If the notes are not signed and they're basically printed out and you sign on paper, those will not be here. But anything that was signed in PhysDoc, if you have a patient in the hospital, when we have this changeover, when we go active with this new version at the end of the month, the prior notes will be here for you to be able to copy and paste. And that's basically ClinDoc. So I'm going to sign this. Now that I can have edited it, I can sign it and see how it shows. It's gone because it's signed. So I have to go back to all notes, and now I see the progress note that I modified and signed today. And as you can see, it was created by me, and then it was signed by me. So, yep. Alrighty. That's basically the documentation module. There's a lot of features there. You can always do a print preview once you've saved a note or signed it. And then you can print it, you can make it larger or look at it if you want to, or you can X out of this window. Remember the macros functionality, it is there. It's very easy to copy and paste. You can add a macro, and you basically give it a short text. You don't have to do a dot, you don't have to do a greater than, less than, none of that. And then you can actually create your macros and save it. If you click to have it shared, it will be shared with everyone else, and they will be able to import your shared macros. If you need more information or help with the macros, I'm happy to help with that at any time. I know a lot of you have it already done through Dragon, but this works really well, especially for those folks that are working telemedicine or don't use Dragon on a regular basis. Or maybe they're working from home and they don't have Dragon at home. Alrighty, this is the end. We can log out right here. And then again, as usual, it asks if you have any incomplete tasks you want to work on. I'm going to continue log out, and that'll be the end of this demonstration. If you have any questions, feel free to contact myself, Hope Whitaker, Lisa Kramer, or Joan DeClark, and we're happy to help you with anything that you need. Thanks for your attention today, and I hope this helped. Have a great day.